The following is paid for by Advanced Physical Medicine of Miami.
The information presented in this program is for educational purposes only. It is not intended to diagnose, treat, or cure any condition, illness, or disease. The depiction of successful results from the treatments discussed in this presentation are examples of the possible benefits and do not guarantee results. The decision to start any medical treatment should be made only after discussing all benefits and risks with a healthcare provider.
Welcome to Healthy Dose Radio. You can find out more about us by visiting our website, apmrmiami.com, and by following us on Facebook and Instagram at apmrmiami. I'm your host, Dr. Joe Gambardella. I'm sitting here today with Johnny Hernandez, our hormone case manager, and also with Rob Sapero. He is our office manager. And today's topic is going to be about bioidentical hormone replacement therapy. What's going on, guys?
How's it going?
Pretty good, pretty good.
Today's topic is a pretty interesting one in the grand scheme of things in terms of the way we look at our patients, Rob and Johnny. We have patients that we take care of for primarily low energy, fatigue, low libido, low drive, can't recover quickly, and it kind of feeds into all of the other service centers that we have in our office in terms of regenerative medicine, physical therapy, and chiropractic. Today is pretty interesting, though, when we talk about hormones, there's really 4 key hormones or prohormones that we look at when we evaluate our patients. We have testosterone, we have estrogen, we have growth hormone, and we also have vitamin D. And I really want to turn it over to you guys just in terms of the patients that we initially see, why they even contact our office, and then we can get a little bit more into the blood work that we do and evaluating each one of these patients.
So to our surprise, patients, coming in with, like Dr. Joe said, brain fog, mood swings, depression, elevated cholesterol. When you think of low testosterone, you think, oh, these are only men 60, 70, 80 years old. But to our surprise, we have patients as early as late 20s, early 30s coming in with similar symptoms when it comes to low T problems. In fact, just to throw out a quick stat out there, there's 13 million men in the U.S. who have low T issues, and only 5 to 10% of them typically seek treatment, which I find pretty astounding.
Yes, I agree. I think the whole hormone replacement thing has become a taboo thing over the past decade or so, when people started becoming a little bit more shy and less open about being on hormone replacement therapy, whether it be male or female.
So let's dive into that. First of all, patients who would be candidates for us typically have a couple of things, as you mentioned, Rob. They have a lot of inflammation, which means that they have a lot of pain. Typically joints are sore, knees are sore, lower backs are sore. We'll do a physical exam on them, and physically they actually look okay. X-rays are taken, but they just tell us that they're not feeling well as far as their recovery, even when their objective findings are clearing. So X-rays look better, physical exams look better, but they're still in pain, they're still not feeling well. And sure enough, we run the tests and we find out that they are well below the acceptable levels on testosterone, and which comes into our point that there's an enormous difference between looking at blood work to be in range and also looking at blood work to be in an acceptable range where your body can recover and repair itself naturally. So for example, testosterone is a really key hormone that is found in men and women. The fraction that's found in women is about 10% of what we typically see in men, but the benefits are the same. When you have optimal levels of testosterone, you have decreased inflammation, you have decreased risk of cardiovascular disease. Overall risks of cancer, including breast cancer and prostate cancer, are significantly lower when your testosterone levels are in an optimal range. To go on down the list, decreased risk of cognitive disorders like Alzheimer's and Parkinson's. You have better sleep, better recovery, and obviously the big one, better sex drive, which is why a lot of people come to see us.
Yeah, it's a very big factor.
So what is a normal testosterone level that we should be looking at? The range of testosterone in males ranges from anywhere from 258 to 1197. With women, the range is somewhere between 2 and 45. It's a huge range. Yes. And the way that they developed these ranges over time was they statistically analyzed men and women in their late teens to early 20s and men and women in their 70s. And they found out that men and women in their 70s that had poor recovery, low drive, low libido, all had ranges that were somewhere between 0 to 2 for females and somewhere between 150 to 250 in males. the opposite is true, and when they surveyed the younger people who had the ability to recover very quickly, they had great libido, great drive, great motivation, were getting results in the gym, recovering quickly. Men had typical ranges between 800, 900, 1,000, and women were somewhere close to 45 to 55. And what we'll see oftentimes is when women and men come into the office, we'll run their testosterone numbers, and they've been told by different types of doctors that they visited that they're normal and healthy. And they're told that because they fall somewhere in the scale.
Yeah, which is true.
Right? How often do we see a 35-year-old guy come into the office? He's got a testosterone level of 350. And he said, hey, I'm just coming here because my testosterone level is normal, but I'm still not feeling well. And having a 35-year-old that has a testosterone level of 350 means that 35-year-old is going to be feeling like a 75-year-old would.
Yeah, and it's very common.
Very, very common, more often than not. And women are the same.
And that's the first thing we explain to our patients is that there's a huge difference between having normal testosterone levels and having optimal levels. You're talking about when you can increase your level from a 350 to a 400 or 400 to a 700, 800 level, it just changes the whole way your body works. Like you said, it improves your sleep. It improves brain function, so your cognitive ability is better. It improves your sleep, your quality of your sleep. You just get an overall sense of well-being from improved sleep and all the other factors. So when people come in saying, oh, I have normal testosterone, we're like, all right, let's do some blood work and let's really see what you have.
Yeah, so we have a full lab in our office. We have the ability to draw blood, send it to the lab, and once we get those levels back, we've tested not just for testosterone, but it's a CBC, which is a complete blood count, a metabolic panel with differential. So we're looking at kidney function, liver function, red blood cells, white blood cells, any signs of autoimmune disorders. We're looking at vitamin D levels. The vitamin D is one of the things.
Very underestimated.
It's a pro-hormone, essentially, when it enters the body. Vitamin D, we live in South Florida. You can get it from some foods. You can get it from being in the sun. But in 20 years of practice, I can count on one hand the number of people that I've seen with optimal levels of vitamin D walk into the office that have never taken a supplement. It just doesn't happen. And vitamin D, if you are low on the scale, because it's considered a pro-hormone, has the ability to significantly increase the amount of testosterone you make, the amount of growth hormone you make, which subsequently affects how well you're able to recover. It affects your libido. If that number is low, it's going to drag your testosterone level down. It's going to drag your growth hormone level down. So your ability to recover, repair, regenerate is significantly impaired. And that's one of the easiest things to fix. Once we run the blood work, we could typically see, the range of vitamin D is somewhere between 30 and 100.
Yeah.
Most patients, Johnny, that we see are somewhere
low 30s, if that.
Low 30s. So they're not getting any of those benefits that we just mentioned.
At all.
And we put them on a supplemental dose that's different than just taking one over the counter. The quality of vitamins and supplements that we take that you buy over the counter versus getting a pharmaceutical grade one that we have available to us in our office makes all the difference.
Night and day. Yeah.
Right. We have patients that, listen, they want to just try to save as much as possible. And I could totally understand that. They'll take a vitamin D that they buy over the counter, which is not an expensive supplement to buy. They'll take a recommended dosage for 2 to 3 months. We come back, their levels don't change.
Doc, now what would you say is the biggest difference between coming to an office like ours, who we specialize in these bioidentical hormones, and just going to a primary or just, a friend in the gym, in the bathroom?
Yeah, so testosterone replacement therapy versus bioidentical is apples and oranges. Testosterone replacement is simply that. You're replacing one hormone because you don't feel well. And a lot of times, specialists and practitioners who dabble in this will just prescribe testosterone and say, I'll see you again in a year. Let me know when you need the refill. Those are typically our most difficult patients to fix, because when you alter testosterone in a man or a woman and you don't address the supplemental hormones that go along with it, you can create more problems than benefits. So for example, you never want to suppress your body's own ability to make what it already does very, very well. What you want to do is support it. So with bioidentical supplementation, you are stimulating your body to make more of these essential hormones. When you can't produce enough of what you need, we bioidentically supplement. So bioidentical hormones versus synthetic hormones are both made in a lab. Bioidenticals are molecularly the same thing that we produce. But the synthetic variants change in that they are then mixed with different types of chemicals and molecules to brand them as a drug so that pharmaceutical companies can make money selling them. Pharmaceutical companies cannot make money selling testosterone, estrogen, and progesterone that are bioidentical because they're produced in the body. But when they change them into a molecular variation called methyl testosterone or Premarin or Provera, these are synthetic drugs. You get some of the benefits of hormone replacement, but you open yourself up to a litany of different types of side effects. In fact, there's a term called hormonophobia that doctors and practitioners and secondarily patients have become afraid of looking at hormones because of some negative information that came out in some case studies years ago.
And that's a big concern with a lot of our patients is what are the side effects? What am I going to experience? And the truth is when it comes to bioidentical hormone replacement, there is no side effects. There's only effects from either overdosing or underdosing. And that's our job. Johnny does a great job managing our patients, making sure that they're getting the blood work when they're supposed to, making sure they're staying on task. So you have somebody literally full time addressing the issues that are going on within your body. And a lot of people are surprised at how thorough we actually do our panel. Johnny, what would you say is some of the common myths that people come in thinking they know about testosterone?
So they think that by taking testosterone, it'll naturally reduce their own production. But again, we do bioidentical hormones, so we address all hormones. We do certain things like ACG to kind of make sure your FSH and LH levels are staying up to par. So the day of tomorrow, whether it be for health reasons or financial reasons, you got to come off the program. We're able to jumpstart your testosterone levels or your hormonal levels again. We also monitor your estrogen levels as well, making sure those don't spike up too much or don't drop too low, because estrogen in men as well has been proven to, kind of raise your libido as well.
And that's key, the 4 pillars of health. What are those, Doc?
So you have certain types of hormones: estrogen, testosterone, growth hormone, and vitamin D. All of those things are necessary in order to build a sustained quality of life in terms of balancing hormones. Just to take one step back in terms of safety, there's a couple of key studies that our audience should know about. And there was one in 2007 from Fournier, and they surveyed over 80,000 postmenopausal women, and they found that women who took a synthetic form of progesterone had a 69% increase in the risk of breast cancer versus women who took bioidentical had 0. There's also a study that speaks about men, the largest to date study on bioidentical hormone replacement therapy that was done in May of 2014 at the Kansas City VA. And they said that women and men who were taking testosterone therapy bioidentical for 15 years were less likely to die of all-cause mortality by a margin of 56% than those who didn't.
Wow.
And they were 24% less likely to have a heart attack or a stroke. 18 to 25 is typically the healthiest patient that we're going to see. Mm-hmm. Hormone levels are the highest at that time. When men and women come in their 50s, 60s, and 70s, and their hormone levels are marginal compared to when they were younger, there's no coincidence that they don't feel as well because of the increased risk of inflammation. Testosterone is the strongest anti-inflammatory medication that you can take, and it's already made in your body. So if we can get the body to produce more of it, as you said, Johnny, we work with young men and men that still want to have children. So we minimize the risk of fertility problems by taking hormones and doing them a specific way.
And that's the best part about these treatments. There's studies, there's science out there. The information is out there if you just look in the right places. Just to add on another great study, Dr. Stephen Masley, an author of several books on heart health, he actually wrote an article about a study that focused on the health benefits of increasing testosterone. This is taking people with less than a 300 total testosterone and getting them to anywhere between 500 to 1,000. And what he found was that there was a 47% decrease in death, an 18% reduction of heart attacks, and a 30% decrease in the risk of stroke. So it's not only cancer, protected, it's protected against cardiovascular disease, and the list goes on.
And typically, patients that are 30 to 40, that's where your biggest drop off in testosterone is going to be. That's typically when you don't start to feel as well. Men and women become fathers and mothers. They don't have as much time to work out, and they think it's just coincidental that they lose all this energy and vitality. But that's also the biggest time in your life that you're going to lose the majority of testosterone that you're able to produce naturally. Growth hormone is similar. Actually, a little bit earlier, you lose the ability to produce growth hormone significantly between the ages of 20 and 30. And growth hormone is so important because in later life, that is what protects our connective tissue. The connective tissue being the heart, the blood vessels, the cushioning of our joints, as well as the cosmetic things that everyone's looking for, like hair, skin, and nails.
More about testosterone and estrogen levels, and coming up, you'll find out the importance of growth hormones and how the sharpest minds are researching and developing the programs at APMR that will increase your levels and decrease your risk of cardiovascular disease and cancer. If you're tired of pain and discomfort and ready to do something about it without surgery or drugs, stay with us.
Repair your body. Replace your key hormone levels. Allow your body to regenerate itself without surgery or meds. When it comes to your health, the best plan is preventative. If you wait for symptoms to show, you could be too late. With over 40 years combined clinical experience, all under one conveniently located state-of-the-art facility, Dr. Joe is on the leading edge of regenerative and physical medicine. Take control of your health and get a free consultation and evaluation. Visit us at apmrmiami.com or call 305-598-8788. 305-598-8788.
This is Healthy Dose with Dr. Joe. If you have any questions for the guys, like the show on Facebook at APMR Miami and post them there. Now back to Johnny, Rob, and Dr. Joe.
So now let's get to growth hormone and why it's so important. Growth hormone is a hormone that is essential in later life, as we mentioned earlier, because of its strong connection to helping the connective tissue in the body stay healthy. This is the hormone that protects your blood vessels, as I mentioned, protects your heart, keeps it healthy for the entirety of your life. And our life expectancy is increasing over time, but it doesn't mean that the quality of life is increasing. And we want to make sure that our patients are functional and have high quality of health for the entirety of their life. When you see people working out in the gym in their 50s, 60s, and 70s, and they look amazing, better than some people in their 20s and 30s, just rest assured that they're doing some sort of hormone replacement program or bioidentical program. Our office is diplomat trained in bioidentical hormone replacement therapy, meaning that we collaborate with the sharpest, brightest minds in the field to put these programs out to our community of patients. And it's typically things that you wouldn't expect an office like ours to have. You would only expect to see things like this in Beverly Hills. But we've taken all that information and brought it to our patients, and the results have been pretty amazing. When you look at blood work and you can balance out someone's testosterone levels, putting them into an optimal range, elevate someone's growth hormone so they recover quicker, they have better libido. We're seeing changes not only in the physical composition of our patients, but in their overall lives, right? How many times have we had men and women, couples say, oh my God, I feel amazing now. My life with my partner is so much better than it was before. We often get patients that come in thinking they're depressed as well. They're on certain types of medications and they think, I need more antidepressants. I need something else. I need more of a stimulant, more of these monster drinks to increase my energy. And really it has nothing to do with it. They're low in these essential hormones. It brings us to another point in that there are some medications out there that people are taking on a regular basis that significantly lower their testosterone levels or their ability to recover, repair their libido and so forth. And one of them is antibiotics. So sustained long-term use of antibiotics significantly lowers testosterone levels. Blood pressure medication, beta blockers, lower testosterone levels. Antidepressants lower testosterone levels. And all of these things really need to be examined to make sure that you're doing the most for your patients. When we work with our patients, the thing that we do as opposed to other practitioners and other offices is that we really specialize in this. We have a whole department in our office, Johnny, that you regulate pretty tightly. I think everyone should know that you started out with us as an intern and then became a physical therapy assistant, really working full-time in our physical therapy department, and you had to migrate over into this as a full-time position because out of the hundreds of people that we work with, we're looking at blood work 4 times a year on these patients.
Yeah, on average, at least.
On average. And so everyone that meets with us, we find out what they're looking for. They meet with our medical staff to get a full examination, and then they do the blood work.
Yeah, fasting blood work. So aside from the cosmetics and the aesthetics of it, we also help people who have other issues with high A1Cs. So we've had patients who come in with a 6.5 A1C, get on our program, and within about a month or two, you'll see the significant drop in A1C to a diabetic range to a pre-diabetic range. So as Dr. Joe mentioned earlier, insulin being one of the hormones that we monitor as well, it does help out as well.
What's A1C?
Hemoglobin A1C is a blood panel marker that measures how well your body is metabolizing fats and sugars over a 90-day span. Okay. It's much more informative and beneficial to look at that number as opposed to fasting glucose or fasting sugar to find out how your body is metabolizing sugar. It allows us to know if you're insulin resistant. And that's one of the things most of our patients are when they come in on a program like this, is they're not metabolizing fats and sugars very well. And that hand in hand with low testosterone equals pre-diabetes and then eventually type 2 diabetes. So we've been able to help so many people who have been in that range actually bring those numbers down and become physically fit, become healthy, come off some of these medications that they were taking that overall weren't making them feel well to begin with.
Wow.
Yeah, this is very true. So as you see, Dr. Joe knows all the information that he needs to take care of you guys. As far as getting the blood work done, nobody can do it for you but yourself. I strongly urge you to do it as soon as you can. It can't hurt you. It's a quick panel. We can do it in office. We can send you to the lab, whether it be LabCorp or Quest. Point is that we got to get it done as soon as possible so we can help you out. In most cases, the insurance does cover the blood work, so there's nothing to worry about it as far as cost. And if there is, we're more than happy to take care of you however we can.
It's really important that everyone needs to know what their numbers are. Most people know what their cholesterol level is. They know what their blood pressure is, but they don't know what their testosterone levels are. And if you want to feel better, have that drive, have that really huge increase in libido, if you want to recover and change your body composition, you have to know what these numbers are.
And it doesn't always have to be testosterone that you're lacking. And that's the great thing about our office is we're looking at the growth hormone, we're looking at vitamin D. And vitamin D alone can change your complete overall well-being. It can make you sleep better, and because of that, you can just have a better day and feel better just with something as improving your vitamin D
Huge
level.
boost to the immune system. I mean, patients ask me if I could only take a couple of supplements, and after being evaluated, there's a couple of key ones, essential fatty acids, but vitamin D is pennies a day to take it, and it significantly reduces your risk of all types of cancer, enhances brain function, protects you from diabetes, protects your joints and keeps you healthy, protects your overall well-being. And it's so important. You can't get it from foods, you can't get it from being out in the sun, and you have to supplement with it.
Yeah, absolutely. This is just a quick stat that I found very, very interesting. It has to do with estrogen. The average 60-year-old man has more circulating estrogen in his blood than an average 60-year-old woman.
And that's typically what we see, is that as we age, we become estrogen dominant, both men and women. And when you become estrogen dominant, the risk of different types of cardiovascular disease and cancer increases significantly, and primarily because the anti-inflammatory testosterone is decreasing, and that's really one of the things that protects your body from some of these inflammatory diseases. And oftentimes that's exactly what we'll see. Estrogen is through the roof, testosterone is lower than optimal, and by changing diet, using things like intermittent fasting and fasting mimicking, we're able to get the body pretty quickly to become less insulin resistant. We're able to get the body to start producing more testosterone, lower the estrogen, and these patients not only feel better, but they look better. When you look at our patient population, the men and women that are doing these bioidentical programs, they look like they should be in magazines.
Absolutely. I can think of a couple, they're 60, 70 years old, look better than me at 30. And
Maybe you should have a calendar.
Yeah.
that's a good idea.
But it's essential. Just, we mentioned in our last show that people often mistake pain as something that's going to come and go. The reason they don't address these types of symptoms is because they can't see them. That's why we take x-rays. And this is the thing. Don't mistake your low energy. Don't mistake your low libido as being depressed per se. Obviously, if clinically that is something that you suffer with, it has to be treated appropriately, but you should also find out what these numbers are, because symptoms of low testosterone and low vitamin D and low growth hormone are very much similar to some of these other conditions out there, and you have to be able to rule things out to find out which treatment is most appropriate for you.
And I think that's key, is just being proactive. Take control of your health. Be intentional with how healthy do you want to be. And the only way to do that is going to a facility like ours, where you can test your hormone levels, you can take x-rays, you can check everything from A to Z, see what you're deficient in, and give us a chance to monitor you, and let Johnny manage you, which again, he does a fantastic job.
Thank you. So yes, call us at our office at 305-598-8788 to schedule your panel today, or reach out via email if you want to get more information at hrt@amrmiami.com, and I'll be more than happy to reply to you as soon as I can, okay?
All right, and we want to thank you for listening to Healthy Dose. You can follow us on Facebook and Instagram at APMR-Miami. You can also check us out at our website, apmrmiami.com. Stay tuned for future episodes where you'll learn more about different ways to repair your body naturally without drugs or unnecessary surgery, on different ways to replace essential vitamins and hormones that have become depleted safely and effectively, and allow your body to regenerate and heal itself. Remember, repair, replace, and regenerate. I'm your healthy host, Dr. Joe Gambardella, and I'll see you next time.
The information presented in this program is for educational purposes only. It is not intended to diagnose, treat, or cure any condition, illness, or disease. The depiction of successful results from the treatments discussed in this presentation are examples of the possible benefits and do not guarantee results. The decision to start any medical treatment should be made only after discussing all benefits and risks with a healthcare provider.